we'll have a better feel with the antibody test about what the actual penetrance of this infection was in society. How many people have actually been infected? Who's protected? If you have antibody, it's very likely that you're protected. Who's vulnerable? Do you treat vulnerables different than you treat the people who are protected? All of these things are going to go into the decision of just how much back to the original way we'd like it to be in the fall. Bottom line is no absolute prediction, but I think we're going to be in good shape. No absolute prediction, but I think we're going to be in good shape.
This one's for Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing?
Much back to the original way we'd like it to be in the fall. Bottom line is no absolute prediction, but I think we're going to be in good shape.
This one's for Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality, and I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that. Forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that. As a COVID-19 death. existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure, you hear from coroners that that's not necessarily the case, or are you sure, how can you be confident about that, and is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have forms that come in and a form that has the ability to mark it as COVID-19 infection. The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure, you hear from coroners that that's not necessarily the case, or are you sure, how can you be confident about that, and is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
How about one more? Go ahead.
A question for Dr. Fauci on the virus hitting Black communities.
Hey everybody, hey guys, I just saw this on a friend.
An interesting piece you put in the Star Tribune recently as well. So I don't know if you like Dr. Jensen, Senator Jensen, but thank you so much for joining us tonight.
Pay attention. Dr. Jensen, Senator Jensen. And I'm going to make this into a mirror.
Tonight, sir, and let's start with this. You and I communicated briefly yesterday via email, shortly on the phone. Have you yet seen the information that's going into these U of M models that the governor is using to make these decisions?
No, we have not. We have asked for those, and we were told by the governor's office that we would receive the data tonight. And so we're hoping to see what the assumptions are and what the data is. But at this point in time, we have not.
So I just want to be clear for our audience, sir. You've got a governor of a state that is making executive orders, stay-at-home orders that right now is cratering your economy. We don't know what data is being used, and yet you as a state senator, as a doctor, have not seen that data that's being used for our governor to make these decisions.
No, we have not. And
does that not concern you? I mean, shouldn't the people of Minnesota be screaming right now?
Well, I think, Minnesota nice. We want to be good soldiers in that, but I think that people are starting to say, hold it now. We need to have a deeper understanding of this, and we're not getting it. I think that, well, in Minnesota, as a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates.
Whoa.
And I've never really received coaching from the...
Wait, what? An email about how to fill out death certificates? That would be interesting. He must be talking about this. Let's listen.
Vital Statistics Agency in terms of how to do a death certificate, but basically...
Oh, wait. Yeah. Vital Statistics Agency on how to do a death certificate. Going to bring this up real quick. See how this says alert 1, this says alert 2. Let's listen.
I felt like they were saying, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19. So
Wait. Sir, I don't mean to interrupt you, but that and what you just said, I think is critically important. Can you repeat what you just said, please?
You think?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient...
Last Friday. No.
that had pneumonia but was never tested for COVID-19, But sometime after she came down with pneumonia, we learned that she had been exposed to her son, who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19.
You heard that just now from an active Minnesota State Senator and doctor, okay? Please pay attention to what this man is saying, because I've been saying it and no one is listening to me. Like a few of you are, and I greatly appreciate you all. Please keep sharing my videos, because I'm not lying. This guy's not lying. They are lying to us.
Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor.
Right?
Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
Hey, I don't know where this is coming.
To the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Here's a great question.
Well, fear is a great way to control people, and
Holy
I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed.
I have